Improving the quality of health care for some of the highest at-risk patients in the country may sound like a lofty goal, but the Patient Safety and Clinical Pharmacy Services Collaborative, or PSPC, has taken on that task. Now in its third year, this innovative collaborative is making a positive, lasting contribution to the profession of pharmacy and some of the most often overlooked patients in the communities these pharmacists serve. Sponsored by the U.S. Department of Health and Human Services Health Resources and Services Administration Office of Pharmacy Affairs, the PSPC is a national effort designed to improve the quality of health care across the country. To do that, it integrates patient-centered clinical pharmacy services into the care and management of high-risk, high-cost, medically complicated patients. This collaborative allows for the strengthening of the patient-centered medical home and addresses medication management risk and safety in an outpatient environment. The outcome is better integrated health care for people in need.
We target them by integrating patient-centered medication management into their care and targeting why they're high risk, and we use an interdisciplinary team approach to target their needs. The collaborative is a vehicle for strengthening the health home and to systematically address medication management risk and safety to truly transform the delivery system.
In the 3 years since it was created, PSPC has made a significant impact, with more than 120 community-based teams now in place within over 300 organizations. Across the board, they are seeing tremendous results in both health outcomes and medication safety improvement. After just 12 months of coordination, the highest-risk patients see a 54% improvement in the status of their health, bringing out-of-control conditions to a manageable status. This rapid cycle approach also has resulted in a 49% decrease in adverse drug events which cause actual harm to patients, and also has helped potential adverse drug events drop by 60%. Part of what makes this program so successful is the extensive personal support provided to each patient. Daily interaction with the most vulnerable patients, those who are high risk, low income, and either uninsured or underinsured, ensures that the patient is put first and that their needs are met on a very personal, individual basis. The program's medication management involves everything from access to medication and services, to medication reconciliation, to education and medication therapy management. Proving the power of partnership, this patient-centered healthcare model utilizes an interdisciplinary approach that typically includes a physician, pharmacist, nurse, and health educators. By incorporating pharmacists and student pharmacists into the care team, the program is providing a higher level of patient care to the communities it serves, while the communities in turn provide pharmacy schools with additional clinical practice sites. In this mutually beneficial setting, student pharmacists receive better training through valuable hands-on clinical experience.
I would say the single greatest accomplishment is focusing on the patient and being able to see so rapidly the improvement in patients' lives day in and day out. It's improving their health outcomes, improving their safety profiles so they're seeing less adverse drug events, and to get them empowered to be self-managers of their health status.
As the program enters its 4th year this fall, it will launch new partnerships that continue to expand this work into even more communities across the country. In keeping with the tradition of setting and attaining high-reaching goals, the collaborative has set a goal to reach 3,000 communities by the year 2015. Thanks to its emerging partners and growing number of teams, PSPC has introduced a new model of safer, more effective care into the current model of healthcare delivery. By delivering these critical comprehensive services to a growing number of high-risk patients, the PSPC is not only changing lives, it's saving them. The APhA Foundation congratulates PSPC on being named the 2011 recipient of the Pinnacle Award for Voluntary Health Agencies, nonprofit organizations, associations, government agencies, and public-private partnerships.